Hello and welcome back to Dr. Carri's Clinical Corner. Today we're going to talk about prolapse. So in this video, I'm going to keep it simple and we're just going to talk about the 4 grades of prolapse. So a prolapse is when your organ is lower in the vagina generally than it should be. It can be a rectal prolapse, but it's pretty rare. We'll talk about that another time. So there's 4 grades to a prolapse. So a normal anatomy would be grade 0. Everything is where it should be. A grade 1 and a grade 2 mean things are lower in the pelvis, but they're still within the pelvis. And usually a grade 1 or 2 is because things got stretched out or there's a lot of pressure. So often with pregnancy or a difficult or long vaginal birth, a lot of that pressure down just sort of stretches the ligaments because our organs are held up by ligaments above. Grade 3 or 4 means things are coming out of the pelvis, of the vagina, and that usually means one of the ligaments that suspends the organ is broken. And so one or more, we don't really know. I can't test that as a pelvic floor therapist. But imagine this little guy. Okay, so this is normal. Everything's in the butt, in the chicken butt. So grade 1 or 2 would be like, I can't even really show it on you. Like, this is probably a grade 1, that it's like you could see it. Grade 2 means it's kind of like right at the edge, but it's not coming out. Grade 3 is like, it's coming out. Maybe it goes back in, but it's like partially out. And grade 4 is like, everything is coming out. In my lifetime, I've seen one person that has a grade 3 or 4. And it was like, everything was out, okay? Most of my patients have grade 1 or 2. We treat it based on symptoms because we can't reverse the ligaments, right? Like if they're stretched or torn, you can't reverse that except for with surgery. But people with grade 1 or 2 generally do fine. So I'm going to keep it short and sweet for that. And then I'll address the other issues in more videos.